My name is Tami Lee. I'm a physician assistant practicing in Roxborough, North Carolina, and I'm part of the Community Practitioner program. The Community Practitioner program has helped our practice tremendously through financial resources as well as through practice management resources.
Now, as a practicing PA, and you mentioned a while ago you could do better in specialty. What led you to do family medicine? What about that attraction?
I started when I was in Duke. I had a rotation in Roxborough for 2 months with a medical doctor here, and just basically fell in love with the rural community and found that they were it was a gratifying population to treat, and just enjoyed this community. So
now, this will be viewed by general population, but also potential CP peers. It could be PAs, could be NPs, mid-levels, or physicians. Someone who's thinking about what to do with their training and their education, what would you tell them about the CPP? How would you encourage them to look at that?
I think probably for the people who are thinking about going into rural medicine, it's a difficult decision, probably financially. I would imagine more so for an MD than for a mid-level provider. And this program does allow people to do that and to have assistance with their loan repayment, which is a big part of, probably the biggest benefit, I suppose, and also is very useful in teaching people how to manage their practice.
What would be the biggest challenge that you've seen so far, not just in practicing of medicine, but just adapting to this lifestyle and this community to
I imagine
do what you do?
For younger people who are looking for a more active lifestyle, there is not a lot to do in Roxborough per se, so most of the entertainment venues are in Durham, unless you like to do things outside, which there's a lot here with the lakes and so forth, but probably as far as entertainment and lifestyle, people would head to Durham or somewhere larger than Roxborough.
In terms of practicing medicine and learning, do you find that gratifying in what you're doing?
Absolutely.
What are some of the things you enjoy about that?
About practicing medicine? I have a large geriatric population, and just visiting with them on a monthly or quarterly basis is just extremely gratifying. Watching them go through the changes of life and watching them add grandchildren and watching their families expand over the years, people that I've treated for 8 years now. It's just enjoyable for me.
If someone were to ask you about pursuing a career as a PA in a rural community, what kind of answer would you give them?
Probably the similar answer, that it's extremely gratifying. You know, you see the patients for years if you stay there and develop relationships with them, where if you were a hospitalist or in a specialty environment, you wouldn't see them long term, and you don't have the kind of continuity that we have in family medicine.